So we are done charting the entire mouth. So we sit the patient back up and we show them their results. So when we finish charting plaque pocket bleeding, it will automatically switch to the next pass, which is recession. So if you notice here on the left-hand side, the red box will be around recession. What we do for recession right now is enter it manually. Have an assistant come in and enter it manually. So, like I said, I sit the patient up, and first I go to the aux panel. I click on there, and I go down to DFP graph. Click on there, and on the right-hand side of the screen, it will come up. You click on Zoom. Another way to pull that up, their chart, is to go to Pareil on the element. Click on that and click on full view. This part of the chart will change, and this is the graph that we are looking for. You click on Zoom, and it will bring the patient's results up. This is from today, and I would then mention to the patient that she is 87% plaque free and 89% bleeding free. If you look down here, she would be in the marginal breakdown. I then would ask the patient what she thinks of her results. And she might tell me she wants better results, or that's good enough, or whatever she tells me, I would address that then and go back to her goals. That, again, 90% and above is where you're going to be at your healthiest. You're going to be less prone to getting cavities, getting disease, and you're going to be more likely to keep your teeth, and that was one of your goals. If these numbers, depending on what they are, if they are below a certain point, I would suggest for her to come back in about 2 weeks and chart the dental fitness charting for her again to see what her results are. Of course, going through OHI before that. After this, I close out of it, and what I normally do is go to this third icon, and that brings up the numbers. The red is bleeding, and the blue is plaque. This is the upper, and if you go down to the lower right and click on lower, you can view the lower. I then close out of that, of course asking the patient if she has any question, and then I would go to print the graph. I go up to the print, hit that, and then I choose Print Dental Fitness Graph and press print. And that will print the results for the patients to take home.
I'd like to explain this section of the chart, but to get these highlighted, we need to go back up under Element, click on Pareil, then these will be more bold here. These you can do manually or with your voice activation as you're charting. If you would make a mistake or look back or something, you want to go to different tooth, say I want to get to tooth number 4, I would on the voice activation say next tooth, or you could click on it. You want to click on it? Yep. Then it'll bring you to 3, but I want to go to tooth number 4, so I would say next tooth again, and that would bring me to tooth number 4. Now if I needed a different site, one thing to check what you're under in pass. If it says recession, it's not going to chart anything with plaque, pocket, or bleeding, so you do need to make sure it's on plaque, pocket, and bleeding, and there that will be highlighted. So now you'd have to do the next tooth, next tooth. Now if I wanted the mesial buccal, I would say next site, next site. and there it's highlighted with the red box, and I could change that. Then I'd say a new number, say it's really a 4 millimeter. So I could in voice activation say 4 millimeter. Otherwise, you would click on the number here, and it should pull up. Sometimes it goes on our other screen, and it has numbers like a calculator, and I could click on 4, and then that should change it there. You can also go here to next section. That would be the next quadrant. Next pass would change things up there. I don't usually use that. It's more the next site, next tooth, next section. Previous section would bring you back. Again, you say these words too in the voice activation. So you can do it either way if you need to make corrections. While you're charting, do the voice activation. If it's after the fact and the patient's gone or something, you realize you need to change something, then you can do it manually.
If you want to get to a tooth and because you missed something or you need to change a number, you can also say T11 or whatever tooth it is. So if you missed a spot on the distal lingual of number 11 and you need to go back, say T11 and then say next site, next site, next site, until you get to the distal lingual. And it shows you if you're on the lingual or the buccal in this area. And pay attention to that, because when you're going from next section, that will change. So we're finished with the charting. Our patient has left and we are ready to close out of the chart. Make sure you always close out of the previous patient's chart. If you have 2 charts up and they're on top of each other, it will chart on the other patient's chart when you're talking also. Always close out after every patient. Do not let them stack up on top of each other. So to close out, you go to the 3rd icon, click that, this screen will come up, and you click OK. Do not just go up and click the X button to get out of it. That will not work. You have to close out each individual patient. Now, if you want to go back into that patient's chart, instead of going to New Patient, because you already charted, you go to the 2nd icon, which is Patient Activity. You click on that. If you're using 2 screens, it will normally come up on your other screen. And you just enter the last name of the patient. And again, click on the patient's name and press OK. This screen will come up then, and it will tell you all of the activity and all the chartings that were done. So you need to highlight what you're looking at and press OK.
Some other things to keep in mind when you are doing the voice charting: do not, or you cannot have a conversation with the patient while it is listening. Tell it to stop listening so you can converse. Also, sometimes loud noises might get recorded or throw the recording off a little bit. That's where you might have to go back to a previous tooth and do a correction. So just be careful while it is recording your voice, what you say or do, or background noises.
If you go to the graph that we print out for the patient, if you go to that and the numbers are 0 or do not look quite right, that probably means that you did not save it. And you can, we didn't show you, but there is an icon on the computer that is also save. And that would be 1, 2, 3, 4th from the left. So you can just click that and then it will save it if you forgot to say save on the voice activation. And then that will bring the numbers on the graph up to date. what our patients leave with is a copy of the graph and their scores, and they also leave with an explanation of the dental fitness program, why we're doing it, why we think it's important, and why it benefits them. And actually helps us also communicate better with the patients.